we are back with another episode of SAX Industry Vitals, which is our really fun little healthcare podcast here at SAX, where we get to talk about what's going on in the industry from the perspective of not only the team here at SAX, but also with the consultants that we work with from the industry. And we have with us today one of those consultants, one of our favorite, if I'm being honest. Don't tell the other guys I said that. Mr. Wiks Moffat is here with us today. Wiks, I've never asked you this question. What's the etymology of Wiks? Where does that come from?
Funny, that's usually either the first question I get or the last question I get.
I haven't asked you. I've known you a while, and I haven't.
My real name is William.
It is, okay.
Kenneth, and I'm the third in my family.
Oh.
So before I was born, my parents were like, if we have a boy, because back then they didn't know, it was a long time ago. And let's avoid confusion around the house, because my grandfather lived one house down too. So I took W.I. from William, K from Kenneth, and added an S.
Awesome. Oh, that's great. Okay,
Very
good.
cool.
That's really cool. That's good.
So yeah, so if you call me Bill or something when I'm walking out, I won't even turn my head.
It's okay. We can just bail on these and just keep talking.
Great.
That's awesome. I've been meaning to ask you that, and I'm glad we got the backstory behind it. So,
And I saw in your signature that it says William.
It does.
Somewhere.
Does your corporate signature say?
Probably
somewhere
like my license says William.
Right, I've seen
And
that
sometimes
somewhere.
when I go to conferences, it'll say William.
Okay.
Because,
Yeah, I've
but-
seen that along
But no
the
one
way.
calls you William.
No.
No.
Good. All right. Good to know. So now I'm not screwing up.
And I have a fourth, or had a fourth, 35
So you have a
years
William as well.
Yes,
And what do you call him?
Liam.
Is that his
Look
middle
at
name?
that.
Yep.
That's very cool.
I'm Leon, and I've always been Leon. I guess it's just not
It's a
not
good-
very
it's a good
entertaining.
name.
I don't have as much entertainment value. Anyway, so thank you for giving us that clarity.
Sure.
Appreciate it. So, Wiks, why don't you tell our audience what you do? The reason that you're here, obviously, is you're in the healthcare space from a consulting perspective. But why don't you tell them a little bit about who you are, what you do, and you already told them why you got your nickname. So
Sure.
they know everything about you now.
So for the last 30 years, I've been in healthcare compliance. And actually, 30 years ago, it kind of didn't even exist. OSHA came into dental, and we decided to start a company.
Sure.
And we have been building compliance companies ever since. I think I'm on my fourth one right now. And it's become a lot more complicated, a lot more sort of niche-y, sort of staying in your own lane. So that's kind of what I've done. Along the way, I also got certified in healthcare compliance, because there didn't used to be a certification when I originally got started in it. And it also used to not be that big of a deal. I mean, healthcare, and no offense to HR people out there, healthcare compliance was generally relegated to HR, if relegated at all. And HR has the name of kind of being, it's a profit suck. It's not a revenue generator. And compliance has really changed a lot over the last 30 years, where there are now compliance officers, and compliance sits with the C-suite, and compliance in many cases can actually generate revenues now. And that's been a big change, which we've really been on top of as well. So that's kind of my background and my history, and where I see that compliance has changed a lot on the grander scale. I mean, in compliance now, or in most organizations, I mean, you can't buy a box of Kleenex without having the compliance officer approve it. And I think people are starting to understand that more now, especially with private equity and all the money entering. And those guys are from Wall Street, and compliance makes them quake in their boots, basically. So it is now becoming to the forefront. Joked with my partners many times that we started our company 25 years too early.
There you go.
But now it seems to be front and center.
Yeah. I was going to say, Debbie, you kind of took the steam a little bit from the first question I was going to ask, which is we believe healthcare compliance is important right now, which is why a lot of our guests have been focused on that. But I was going to ask you, like, why now? Right? Why is healthcare compliance more important now than it has been in the past? But I think you did a nice job of summarizing that. Really, it's
well. Thank you. I guess to add to that a little bit is value-based care, private equity, all of these things have made it go to the forefront, and healthcare is kind of like the third rail of politics.
Yeah.
And we
It is.
spend a lot of money on it, and healthcare costs too much, and the quality's not as high as it should be. And those two don't play on the graph very well together. If you need to get costs down and quality up, it's easy to get
Sure.
costs down, but quality goes down. So there's a lot going on in that area. And now with all the IT and cybersecurity, I mean, it's just, there are now so many areas and niches of compliance. It's crazy.
Yeah.
I mean, it's all we do, and we can barely stay on top of it.
Debbie, I'm sorry, I interrupted
Oh
you.
no, well, I guess a few questions. So do you focus, would you say maybe you individually or your company, do you focus on one sector of the compliance? Or is it pretty broad? Or are you forever changing based on how the landscape is changing with private equity and all that's taken place?
So yes and yes and yes, basically. First, my expertise and my company's expertise has we work with over 1,000 medical practices, and probably 80% of our clients are medical practices. But we also will work, where we're starting to get hired by hospitals because they're buying medical practices, as you well know. We're starting to work with, we'll work with business associates. We just started working with a group that came in from Germany that was doing 3D printing in the dental area, and we're like, well, are you guys going to be doing billing? Are you going to be handling PHI?
Yep.
And they're like, yeah, well, have you thought of, and all these engineers, brilliant people, had no idea of the regulatory nightmare that we're walking into. So we'll work with companies like that to advise them, but mostly it's physician practices has been our specialty. So that's sort of on the segment side of the actual industry. As far as the services that we generally provide, I've always categorized it into really 3 areas. One is compliance, fraud, waste, and abuse, code of conduct, ethics, billing, all of that stuff. That's where your money is. The other one is HIPAA, privacy and security. And the other one that's really big too is OSHA. That's coming back now, mostly, not because of COVID, by the way, but mostly, unfortunately, because of violence in the workplace, aggressive patients,
Wow.
active shooter.
Yeah.
Just a real quick story. Large group here in New Jersey that we've been working with for years, but we signed more of a master services type agreement to do all their compliance stuff. We were going to start with compliance, billing and HIPAA and all of that stuff. And we actually, basically the day they signed the contract, they said, you know what, because we did have the OSHA stuff down there kind of on the bottom. And they said, we want to put the OSHA stuff to the top for violence in the workplace and manage of aggressive patients and active shooter, because they had someone come into one of their satellite offices and the mother was with her son and she got bad news.
Yeah.
Like not a good diagnosis. And on the way out, they said, hey, Bob or whatever his name is, can you stop by? You owe us money. And it was like $6,400 or something. And he's like, we can't, this was background. He goes, we're wondering how we're going to buy a turkey for Thanksgiving. And you're giving me this news, and on top of it, telling me I owe you money.
Yeah.
He said, Mom, get out to the car, and he looked at the poor little receptionist. He goes, I'll be back in a few minutes. He never came back, but that spread like wildfire
Like a
through the
threat.
entire organization. Like saying, do we have our violence in the workplace? I mean, where's our safe room? Who's doing a head count? Do we have the procedure in place? Who's calling 911 and all that stuff? And all of a sudden, all this money and cybersecurity stuff that was so important took just a slight backseat to that. So kind of going all over the map with my answers, but that's those are the areas in which we generally focus with compliance. And the industry is predominantly physician practices.
I think you're going all over the map because that's where the needs are.
It's crazy,
right? But that's the needs.
It
It's
is
not
all
like
over the map.
it isn't a one-trick thing here for
Right.
you guys anymore. And,
And all of the seminars or webinars that I see besides compliance in the regulatory space is workplace violence.
Yep.
that's
It's
incredible.
it's unfortunate that I get stuff out of those seminars too. I mean, it makes me think a little bit more when I'm standing in a bar, like,
Yeah.
what are we
Well, I
gonna do
remember
here?
one with the surgery center, and basically it was, once you're in the surgical room, there's no way to get out.
Right.
And I'm thinking, wow, even when you go in for a procedure,
Right.
right? Now all of a sudden you're looking around like, well, first of all, I'll be under, right? I won't know, maybe,
Yep.
right? And even I had surgery at a New York hospital, and they're like, oh, you're able-bodied, you could walk in, right?
Yeah,
You
sure.
don't need a wheelchair,
Yeah.
so I walked. And then I saw, just thinking differently because of what we do, and then I saw the lock on the keypad, right, like going in.
Right.
And I was like, wow, okay, at least we have safety going
Yeah.
in, right? Everyone has to use a code, like, to get into this
Yeah.
operatory.
Is there regionality to that physical security concern these days, or is
I
that a
think it's-
countrywide issue right
it's-
now?
Everywhere.
Widespread.
Wow.
Well, you bring up a good example. Let's use this room. Let's say we invite Talia in here today because
Sure.
it's her, we're doing layoffs and it's her last day of employment. We're sitting
Surprise.
in. Yeah.
This is clearly
Yeah.
a
You just happen
hypothetical
to-
situation.
it's going to get worse.
You just happen to be
by the
sitting
way.
here, yeah.
We're sitting in the exact wrong spot
Right.
because if she freaks out,
Yeah.
where are we going to go?
Right.
Nowhere. I mean, there's a wall behind here, I think.
Yeah, there is,
You
yeah.
can't see it. So
She's
You know,
also
it's-
very scrappy
it's
too,
all
so once
things
she
like
starts
that.
swinging, it's all over.
I saw her set this thing up. She looked very strong. And,
But that's I never realized that
Yeah.
was such a growing issue now. And
Because like you said, if someone's getting bad news,
yeah,
or maybe someone doesn't make it out of
yeah, no, it's
a
the
surgery,
the
right?
environment is ripe for high
and
emotion.
that gets into operations too.
Yeah.
I mean, you know what? Don't give this guy that news.
Yeah,
on
right,
the way out.
Right.
Okay.
Right.
Yeah, no,
Just
that's
don't. I mean,
there should
that's not
be
a
better.
That's not a compliance
That's
thing.
emotional intelligence.
It should be
that's
practice.
just
It should be a better
common
practice
sense.
associated. Yeah.
So, yeah, compliance. The reason it's all over the map is because
Yeah.
it gets its fingers into everything.
Yeah, that's amazing. So my background is in technology,
Mm-hmm.
and we're on what I believe is the precipice of maybe one of the most monumental shifts and changes, and maybe in human history. I'm being very dramatic, but I'm doing so
Yeah, it's-
because I believe in it that significantly. Healthcare has generally and historically been on the forefront from a technology perspective. Has to be, right? Based on
Yeah.
what they're doing. Are you hearing or seeing concern in the industry right now, or attention? I mean, AI is a very, very popular buzzword right now, but and I think we're all hoping that it's going to drive the healthcare industry forward in ways that it's never even thought of, before. But what are you hearing, from the insides, and maybe from a compliance perspective, sure, but just in general about this soon to be, massive shift from a technology perspective?
So, it's a great question. You can't do a podcast or go to a seminar.
It's
I'm
impossible.
sure next week when we go to
Right.
the
Yep.
HLA thing, I guarantee you there'll be something on
Definitely.
Yeah.
And I think people that tell you they've figured it out and they know exactly what's going
Definitely
on, they're full of it because it's crazy. I mean, I use it in my personal life, and there's a lot of great things about it. There's some things that scare me about it, but specifically with regards to compliance, I work best with real stories.
Right.
So, a group also here in New Jersey, big group, 200 docs, 40 locations. They, you probably know them. If not, I should introduce you to them. But anyway, we were in there doing their coding and chart audit,
Yep.
which is one of our most popular services because that's where the money is. That's what's throwing off the red flags, and the government is going out talking about trends, doing tons of enforcement
Sure,
these days.
sure.
Because they're getting $11 back for every one they spend on enforcement.
Mm-hmm.
It's a pretty good return.
That's significant. Yeah.
I wish my 401k did that.
Not in today's
Probably wouldn't be sitting here. No
Yeah,
offense
yeah.
to you guys. But, so we came in. and we're doing all coding and chart audit for them, due diligence, everything. And they have AI in there to do their revenue cycle,
Mhm.
and their AI claims that it's 95% accurate, which is good.
Yeah,
I mean,
sure.
Medicare's not gonna give you a hassle if you're 95%. That's kind of the unofficial,
Sure.
like, we'll leave you alone, because everybody makes a mistake. So we went in there and we said, we should probably check it out for you.
Right,
Yeah.
test it.
See how it goes. And most people think the end of the story is going to be that they were hanging their butts out to,
Yeah, yeah,
to
yeah.
to be exposed. It was the opposite. It was actually down coding for them
Mm-hmm.
to the tune of about $80,000
Wow,
per year per physician. Multiply
And they have
that
200?
200.
wow,
Yeah,
that's,
I mean,
yeah,
you,
significant.
you're an accountant, you can do the math.
That's pretty
It
significant.
gets into the millions pretty
Yeah.
quick.
Yeah.
And that's a big number. And they said to us, well, that's gonna be tough. We can't go back.
No, can only go forward.
But going forward, they said, well, what happens next year when we get audited?
Right.
I said, bring it on. Because you should get paid for what you're doing.
Sure.
And you might also think that our recommendation would be to can the AI company. We're like, no, it's actually
it's
quite good.
learning.
It just needs to be tweaked.
Yeah, sure.
And it should be checked. By the way, in 3 years, that may not exist anymore because AI is gonna
Yeah.
be blowing us all out of jobs. I don't know. But right now, we're like, you should check it. So that's my
Yeah.
own kind of,
It's smart practice. I mean, I think any new technology, right, for the last
Right.
50 years, 60 years, you don't put blind faith in it. You fact check, you validate, right, before. And like any new technology, it will improve. And there is some manual intervention in that improvement process. I think the difference that we're seeing, though, is the rate at which it will improve is, I think, unlike what we've ever seen historically. That's going to be the big differential.
And I think on the clinical side, AI has been there for a few
Yeah.
years
Oh,
now,
yeah.
right, yep.
More in the
Well, like I said,
dermatology space.
Without a doubt. Healthcare
Right.
has always been at the forefront of technology. And I think they've been early adopters of AI as they were early adopters of cloud, or as they were early adopters, it's
Right.
always been.
Right.
So, I think we're still, the general consumers are still in the place where they think that AI is new, and it's not. It's been around for a
Right.
long time. I think the proliferation of AI is being driven by, the ChatGPT, right?
Right.
The availability of ChatGPT at the public place, and the fact that it's a large language model, which is really the first proper LLM introduced into the marketplace. So that's when we're going to see everything start to snowball here. But
Right.
But I have a question, so back
Sure.
to, so it wasn't billing at the rate that it should have.
Mhm.
Now, when that audit takes place, have you ever seen upward adjustments of that type?
Yes.
Oh,
You
okay.
mean where they're overbilling?
Yeah, no, where they're underbilling and there should have been an adjustment.
Yes, often, and that's what we call compliance as a profit center. Different
Right.
companies
Right.
might call.
Right.
So we'll go in there and we'll look at a few different items to see where they're leaving money on the table. And one of them might be with their payment integrity.
mm-hmm.
And that's the deals that they have signed with the insurance companies. And let's say UHI gives you $100 for an annual wellness visit. Well, it's funny because the EMR, even though it picks it up, we didn't do anything about it. They've been paying us $99.31. Well, when you do 100 of those a day,
Sure.
and it's real money, and you should be getting paid that. So we'll look for some areas where there's sort of easy pickings.
Yeah.
And that helps a lot. That's sort of the least glamorous part of, if there's anything glamorous at all, about compliance as a profit center. But the next one is the coding and chart audit. More often than not, it depends on specialty, but oftentimes we'll say, hey, you know what, you're doing this procedure. You just didn't document it properly.
Right.
You should be getting paid the full amount, so we'll find something there. And the sort of rock star of compliance as a profit center is all the value-based care stuff. Chronic care management, patient monitoring, telemedicine, all the things that they can be doing
Sure.
to get their value-based score up, and also add additional, lines of revenue through ancillary services. So those are areas, and sometimes we will find that, obviously they have been overcoding or there's a problem. Well, that's valuable information
Yeah,
too.
of course, yeah.
To protect them.
Yeah,
Yeah,
because
of
you're gonna
course.
wanna know that.
Yeah.
You're gonna get a knock on the door pretty soon, and if you can show that you found the problem
Right.
and you solved it, and you've taken reasonable precautions, that's what a compliance program is supposed to do. Everybody thinks a compliance program is supposed to prevent all stuff from happening. Well, it will and can and should, but really compliance is an ongoing, evolving thing
Sure.
that is designed to pick up where we make mistakes
Sure.
and we find them ourselves and we self-disclose it. Because if you don't self-disclose, let's say, a billing error, they can extrapolate and do treble damages, and your little $3,000 fine can go up to $1 million.
Of course.
Whereas if you find it yourself and say, hey, we missed this, guys, sorry, we made a mistake, and we owe you this money, you either
Yeah.
write them a check or they take it out
Right, over
ensuing
time.
payments. So that's really important to know as well.
Sure. I think you've sort of dovetailed nicely into an opportunity I'll take to kind of pitch what we do along with what you do, which is what you do is very consultative. Compliance has become very consultative, right? It's not a black and white engagement, and nor is what we do. And I think we've said it for a long time now that our compliance, as we look at compliance, for we call the tax and audit business the compliance part of our business, right?
It is,
Because it is it's
Yep.
compliance, it's required, et cetera. But we've really become an advisory firm first and foremost. And I'm not saying that compliance takes a back seat, but as business has gotten increasingly complex, specifically in healthcare, because I got to be honest, like it has become mind-numbingly complex if you really spend the time to think about it. What Debbie has really become is a healthcare consultant, business consultant to her healthcare clients.
Right.
And I think that we say it a lot, but there is no better scenario than just having the right team. It's all about having the right
Right.
team in
For
place.
sure.
Right.
And I think that's where working with you and some of the other consultants that we've had on our podcast so far is really that's our differentiator. Is that
And
we know what we don't know, and
Right.
we're willing to engage the right consultants in the business because that's what we spend
Yeah.
most of our time doing.
Absolutely.
So, sorry, go ahead.
No, I was gonna say, and then we reach out to each other.
Right, exactly.
If I have
That's
a client.
creating
they're
that
getting-
network of,
right.
of genuine trusted professionals is what we've tried to build on behalf of our client base, and that's why we do this podcast, really, is to broker those things. I want to be cognizant of time. We're sort of up against the clock that we set for ourselves, but Wiks, let me ask you this, because I think that we value your opinion very much so in the marketplace, and it also gives us some guidance as far as what we see. You're welcome. Forget about compliance for a second. Just think about everything you know about the healthcare industry. What is this? Is a very general question too, by the way. What is your personal prediction of what the healthcare marketplace is going to look like in the next 3 to 5 years? Like, what do you, in your head, what do you think is going to change? What do you think is going to happen? What do you think is going to be impacting? Like, what do you predict that we're going to see in healthcare in 3 to 5 years' time?
So, good question. I think, first of all, there's so much going on in healthcare. I could say, well, which sector do you want to talk about? But on a very large scale, I think all this private equity and all this money getting involved, I think you're going to continue to see that. Yeah, we read the bad press about what Cerberus did with Stewart, and everything came true that was bad about private equity, but there were 99 others that worked out well that we don't hear of because it doesn't make the press.
Sure.
And the government doesn't want to go after that. So I think you're going to see a lot of oversight and scrutiny there.
Sure.
Which also, when I was at a conference out in Chicago, it was a great conference, it was the McGuire Woods Law Conference, someone had said, they were talking about compliance, and they said, well, with the government going in there and not liking private equity, because government doesn't like private equity, you guys know that, what they're going to do is they're gonna, like the way they took Al Capone down for taxes. Meanwhile, he killed 200
Yeah, sure.
people, but they got him on taxes.
Right,
They're like,
right.
they're gonna get you on a HIPAA violation.
Right.
They're gonna get you on they're gonna look for everything else, which, and I'm not saying that self-servingly to build up our business, but I think there'll be a lot more crackdown on compliance. I think, and I'm one of the people that, I don't know if I would say I'm pro private equity, but this has become so complicated
Right.
from an IT standpoint.
Oh God, yeah.
You know what? Your average doctor's office, when we started in the business, Debbie, it was generally the doctor's spouse that was the office
Right,
manager.
right. And she did everything.
Yes.
She
Yeah.
was HR.
I said doctor's spouse.
Yes,
I
that's
you said
you're
she,
absolutely
so,
right.
Oh, okay.
I was trying to be
Whom it
non-sexist.
might be. Yeah.
Right.
Okay.
At any rate, yeah. So gone are those days.
Yeah.
I mean, you need somebody that is an IT expert, you need somebody that's a financial expert, you need somebody that's a billing
Sure.
expert. And by the way, you need good doctors too. And so I think over the next few years, and I think if interest rates go back down again, I think you'll see an onslaught of private equity coming back in again, because they don't seem to be setting up a lot of platform companies
Sure,
these days.
sure.
And I think people are just waiting.
That's a great summary. I think we're hearing a lot of the same. I wish I could say that. I wish I could say that there was a dramatically different opinion from some of the other consultants we've been engaging with, but that seems to be the pretty consistent story. So whether or not that happens, we'll just have to buckle up and wait and see.
Yeah, we'll watch this in 3 years. And
Yeah, exactly, and see if it holds up.
Yeah.
Private equity is making an impact in virtually every, including our landscape, right? I mean, who would have thought they would have been in the accounting space, and here they are, and making
Yeah.
a lot of noise, and
I have one more question
Yeah.
before we wrap up. Would you say the majority of practices that become your client, are they coming to you first based on a pain point? Either they're receiving a letter that they have to comply with, or are they voluntarily coming because they realize
That's a great question.
it is just such a complex field right now that they just really need to make sure that they're trued up in their practice?
It's funny, because this is just a guess off the top of my head, but it used to be 90%.
Yeah.
The feds are in my office.
Right.
I got a letter.
Right.
Well, I'm kind of screwed.
Sure.
Can you guys help us? Yes, of course we can. We can try. Now I'd say it's closer to 50-50,
Okay.
where we still get those calls. Feds are in my lobby, but a lot of them are saying, "Hey, we really need to start thinking
Right,
about this."
definitely.
And what I was going to say to your point earlier is, it's interesting when I do my first review with a client. It used to be, tell me about your OSHA program, tell me about your compliance program, tell me about this, tell me about that. And that was kind of cut and dry. Now it's more like, what are you doing with the business? What are your plans in the next 6, 18,
Sure.
36 months? And that right there gets into compliance and gets into
Sure.
why sometimes I'm able to refer you guys business,
Sure.
which you do a great job with, and saying, that they don't like their accountant, or they think
Sure.
they've kind of outran him or her, and they need somebody else who can be more of an advisor. So that's
I think that's
It's
great,
changed.
by the way. I think that the fact that you're seeing the shift from 90% to 50-50 it's validating a couple things. One, it's validating that what we're saying is actually starting
Sure.
to gain traction, which is that you need the right team and you need an advisor early rather than too late.
Yep.
Because then the alternative happens and you don't want that letter. So
Right.
is it possible to prevent it? So I think that's the first, big variable. And then the second thing is I think it shows a maturing of the compliance space in the healthcare industry. Right? People are starting to pay more attention and it's resonating. It's not an afterthought anymore, which it really never should have been in the first place.
Yeah.
And compliance adds to the value, right?
Without a
Because
doubt.
when you do have PE deals,
Yeah.
not only do they want to make sure the legal structure is in place, right, the accounting's in place, but behind it,
Yeah.
right, is compliance.
Yeah. Well, and I know we keep saying real quick before we're ending, but PE is also keeping us really busy right now with their portfolio companies.
Yeah.
Because they're not buying, so they're saying, let's make sure the horses in our stables are in really good shape.
Sure.
So when we do sell, or when we do add
EBITDA,
on,
EBITDA.
we're
That's
in
the
good
drive.
shape.
Yeah.
And compliance as a profit center really helps that too,
Yeah.
because we'll say, hey, maybe you can also increase your EBITDA while we're in
For
there.
sure, yeah,
So-
for sure. That's awesome. Well, listen, we're up against the time. We're way past the time that we had allotted, but that's okay.
That's
Wiks-
my fault.
That's fine. That's perfectly fine. We really appreciate you coming to chat with us today, and you know, we're grateful for your continued partnership with the firm and your support, and we're excited for what's coming next for all of us. So stay tuned for the podcast. All thousands of people that are out there listening.
Oh my
Yes.
God, well, since Debbie was here, it's gonna be hundreds of
Oh,
thousands.
yes.
Hundreds of thousands of people that are listening, and we'll see you next time.
All
Thanks
right.
for tuning in.